Hi, my name is Lori. I'm a student from Wayne Community College, and I'm going to be doing a newborn head-to-toe assessment on this baby. So the first thing I'll be doing is knocking on the door and introducing myself to the parents. Hi Mom, I'm just going to be doing a newborn head-to-toe assessment. The first thing that I'll be doing is washing my hands. I'm going to go ahead and put on some gloves and making sure that I have the proper equipment to do this newborn head-to-toe assessment. So I'm going to be needing the bulb syringe inside the bassinet just in case we need to suction any secretions. I'm going to need a thermometer, stethoscope, and a pen light. I'm going to go ahead and check and see if the ID bands match. So baby's ID band matches with mom. Very good, just to ensure that we have the correct baby. And then right now that the baby is safe in the bassinet, no teddy bears or anything that interferes with safety is noted. So right now the baby seems calm. He is active and awake. There are some spontaneous movements that are noted. I'm gonna go ahead and check the respirations while the baby is calm. So since the baby breathes with the abdomen, I'm gonna be checking the respirations for 1 minute. So respirations were counted and I counted a total of 30, which is normal. While the baby is calm, I'm also gonna be auscultating the lung sounds. I'm gonna be using the diaphragm side. So I'm gonna be hearing on the side here. Okay, very well. And then I'm gonna be listening on this other side. Very good. So lung sounds are clear to auscultation bilaterally. I'm also gonna be listening for heart sounds. So I'm gonna be listening here for the aortic area. Okay, I'm gonna listening to the pulmonic, Erb's point, tricuspid, and the mitral area, which is the apical pulse. Gonna be counting that for a full minute. Okay, and I did count 130, which is expected. While we're at it, I'm gonna be listening for vowel sounds as well. So I'm gonna start down here, the ascending to just the ascending, and then the ascending to transverse, transverse to descending, and then descending. Okay, very well. All right, so next thing that I'll be doing is inspecting the head to look at the shape. Okay, looks symmetrical. I'm gonna go ahead and be assessing the anterior and posterior fontanelles. They should be soft and flat. Okay, I'm gonna go ahead and palpate the suture lines and making sure that there's detecting any molding, caput, or cephalohematomas. Okay, I'm gonna go ahead and check the neck mobility. So let's see. Just making sure that this baby can move the head freely. So range of motion is good, not limited. I'm gonna go ahead and check the eye placement, making sure that it's aligned with the ears, or the ears are aligned with the outer canthus of the eyes. Very good. I'm gonna go ahead and assess the red reflex by shining this light. Very good. Perfect. Okay. All right, and then next thing that I'll be doing is checking for the nasal patency. So I'm gonna occlude one of the nostrils. Okay, I'm gonna occlude the other side. Very good. Okay, the nose is patent. I'm gonna go ahead and assess the rooting reflex. This just kind of helps me see if the baby is hungry. Very good. Okay, I'm gonna go ahead and check the mucous membranes. They are pink and moist. I'm gonna insert my gloved finger inside the mouth and check for the sucking reflex. Okay, just letting me know if the baby has like a good sucking reflex. Okay, and then the palate is intact. Okay, Next thing, I'm just looking for the skin. So the skin appears to be dry, warm, no cyanosis noted, pink, and I don't know any bruising, and no jaundice. Okay, and I am gonna go ahead and inspect the nipples. The nipples are symmetrical with the midclavicular line. However, I do know an additional nipple here, and I'm gonna go ahead and explain to the parents that this is an abnormal finding. And since this is a female, the nipple, when the baby starts growing into older developmental stages, will not have like any discharge or anything like that. It can be surgically removed later in life. And looking at the abdomen here, I'm looking at the umbilicus, and the umbilicus is dry and clamped. However, I do notice some redness, a little bit of swelling, and some discharge. Okay, moving on here. I'm also looking at the clavicles to see if there's any crepitus. Okay, none noted. Okay, all right, moving down. I'm gonna check the pulses here. Okay, and the femoral pulses are 2+ equal bilat. Now I'm gonna also check the brachial pulses. Those are 2+ equal bilat as well. Go ahead and check the fingers here for capillary refill. I'm gonna go ahead and count them. 3, 4, 5, okay. 1, 2, 3, 4, 5. Cap refill is less than 2 seconds brisk. Okay, I'm gonna go ahead and check here for hip stability and see if there's any crepitus noted. So first thing I'm gonna do is the Barlow test. So the Barlow one is kind of like where you bend the legs back. Okay, very good. And then the Ortolani is like where you bend them back and kind of out. Okay, very good. So no crepitus noted. I'm gonna go ahead and assess for the Babinski reflex. So you stroke the bottom of the feet and the toes kind of fan out. And yes, that was appropriate. Very good. So this checks for any neurological problems and none noted. And then the last one I'm gonna assess is the Moro or startle reflex. So basically you're lifting the baby by like the hands and kind of like dropping them back a little bit. So it's just ensuring that they have a protective startle. Okay, very good. And then I'm gonna go ahead and undo the diaper to check the genitals. So when I undo the diaper, I'm gonna be checking for the labia here. I do notice some vernix on the creases of the thighs. The genitals look appropriate. I'm gonna be inspecting the anus there. I do see some meconium present, so that lets me know that the anus is patent. I'll go ahead and put that diaper back on. Okay, and then I'm gonna check the back here and just check the spine for alignment. Very good, it's aligned, and I don't see any dimples, Mongolian spots on there. Okay, and then the last thing I'll be assessing is the temperature. I'm gonna put this under their armpit, putting it down, since this is the part that they dislike a lot. And the temperature is 97.8, which is normal. Okay, I'm gonna go ahead and replace this back on. And put the blanket back on. Okay. All right, so I'm gonna hand the baby back to mom, and then I'll just be documenting the abnormal findings. And that'll be the end of the newborn head to toe assessment.